Hello everyone, I'm Meera Shah, audiologist, speech therapist and counselor. In today's video, we are going to talk about some very early pointers that we can get which can indicate the child has autism. In this video, we are going to talk about not just the clinical definitions, but we are going to go beyond it, the pointers which are derived from day-to-day experiences that we have with hundreds of patients and parents that we deal with. So let's dive deep into it. This isn't just a checklist video. Usually, parents come with complaints like speech delay or unusual behavior or just a gut feeling that something is off. Normally, speech delay is the most common complaint that they have, but apart from that, there are a lot of subtle things which parents can pick up on a day-to-day basis. And again, what is it that they feel about it? When we discuss that and when we educate ourselves about that, we can pick up autism very early on. Eye contact indicates how we connect with the world around us. Kids, when they are joyous, when they are excited, or when they are confused and distressed, they need help, that's when usually they give eye contact, they look at our face. But when it is consistently missing, there's something that we need to dig deeper. Kids on spectrum, they find eye contact very overstimulating, they find it very overwhelming, so rather than engaging, they look away. One of the parents literally said that, I sense that my child is looking through me, but not at me. It's a very subtle sign of emotional disconnect, which we as parents also, we can sense it much before than we can actually put it in words. Often parents come with a worry that their child has some sort of hearing problem because the child is not responding to the name call. But when they get the testing done, the hearing seems to be fine. They respond to all the beeps and the test is also normal. Also, they also notice that the child responds very well to the cartoon jingle, or if the sound of the favorite food packet is there, they respond very well. So here what is actually happening is the hearing may be fine, but the issue is with the intent of the sound. Kids on spectrum find it difficult to associate human voice, and when they call out the name, the intent to respond, they don't necessarily know that there is a need to respond when they are being called to. So if your child does that, he misses responding to the name call again and again, it's worth noting and getting things tested. We normally see sweet moments with kids, like when they see simple things like a bird sitting outside the window or a balloon floating away. They come and look at you with excitement, trying to say that, did you see that? This is shared attention. When the child looks at certain things and then looks back at you, or when the child brings the toys and shows you, and they look at how you respond at things, it is a very important milestone. If the child consistently misses doing that, it's missing out on a very important milestone of social communication. We need to check that. If the child does not show signs of shared attention, it does not mean that the child is not observing or is not curious about it. It's just that the child is processing the world differently. But if this keeps on happening over and over again, it should not be overlooked, it should be checked. In clinic, we often do small gestures like clapping, tapping, blowing kisses to see how the child responds. Imitation is very important for learning. Kids on spectrum, they find it very difficult. It's not that they are not understanding what's happening, but there is a need to copy and go along in the flow is something that doesn't come naturally to them. So if your child does not imitate your actions or gestures or sounds consistently, it is worth noting. So in clinic with a younger child, we often give them simple commands like, please pass the ball, making sure that we are not using any gestures. If there is no response, then we use gesture, please pass the ball. But still, if there is no response, this indicates not that the child is not interested or he doesn't want to obey. It's rather a verbal language processing difficulty which is often present in autism. If your child is not doing the simple one-step commands, especially when those are the commands, those are the instructions that they have kept on hearing on a day-to-day basis, it indicates language understanding processing difficulty which is there in autism. When we talk about speech delay, it is not just whether the child has words or not, or how many words the child is using. It is more about the intention or how exactly the child is using those words for communication. Some kids may be using words, but it could be repetitive words like certain taglines from the songs or TV commercials. Or sometimes some kids might be using actual language, but it is only for need-based communication. I want this, I want that. But apart from that, there is no word usage happening for real interaction. So in my clinic, I often hear parents say that the child is talking all the time. But when we break it down, it is more so just repetitive speech without any intention, which is called as echolalia. Echolalia is a normal early language development. It's a part of it, but that should not be the only form of communication. As the child grows, it evolves into more of functional language usage. If that is missing, then that's a red flag. Communication is not just talking, it is about connecting. When that kind of connection is absent or it's one-sided, it's time to dig deeper. It is normal for every kid to have their own quirks, whether it may be lining up the toys or spinning certain toys. But when it comes to autism, these kind of repetitive behaviors are very persistent, they're very rigid, and it dominates their playtime. Things like pouring water from one cup to the other, flapping hands, tiptoeing, watching the fan, and many such things they can do for hours together without even looking once. So it seems like these kind of behaviors, they limit them from exploring different new things and learning from it. But actually what is happening is these kind of behaviors give them calming sensation, it is soothing them, it gives them some sort of regulation. So if your child gets distressed when their typical behaviors are disturbed, or if there is lack of variation and imagination in their play behavior, it's time to get it checked. One of the most misunderstood signs of autism is sensory sensitivity. A child may scream while wearing socks or eating certain kind of food textures, or when certain sounds they hear. I've seen kids who survive only on one or two types of food, or maybe even just a drop of water falls on their t-shirt, they have a severe outburst. This is not behavioral issue, this is due to their sensitivity. These activities may seem very simple, but they are very overwhelming on their sensitive nervous system, which is why they react like that. So if for your child daily routines like brushing their teeth or getting dressed or going out and talking to someone becomes a battleground, then it's time you talk to a professional who has experience with sensory integration. When a child can't express himself through communication, he is left with no choice but to show it through his behavior. Behaviors like biting, hitting, screaming, head banging. One of the child who had come, he used to get very angry and used to hit someone when anyone used to take their toy. When we introduced picture communication board and taught him how to point to no or my turn, eventually in few weeks those kind of behaviors reduced a lot. Aggression, resistance or extreme frustration stems from communication breakdown, not just bad behavior. But when we give certain tools with which the child can communicate, then their world and ours change. One of the alarming thing is when a child who had started speaking simple things like a car or mama, papa, and then he stops saying it. I remember one of the mother who had come was sharing that the child had started becoming so excited every time mother or father used to come back from office. He used to say, "Mama come, Papa come," or he used to even hum nursery rhymes and point to various things in the house when asked for. But eventually, in few weeks, everything had stopped. Even simple babbling had stopped, and there was just a distant gaze, and the child was lost in his own world. This is called as regression. It is very common in autism. If you notice that your child has stopped saying certain words or gestures which he used to do it very frequently and enthusiastically earlier, do not waste time. Trust your instincts and take action. Do not let the reassurances like give him time, he will cover it up, wait for some time, that leads to just a waste of time. Take action. There's no harm in at least consulting the professional to understand what it is. If you have seen few of these early signs of autism in your child, don't worry, it's not your fault. Your child is not broken. Autism is not a failure to develop, it's a different way of developing. Early signs does not always mean diagnosis, but it means that it is time to explore more. It's time to understand, it's time to support and give the necessary tools for your child. You don't need to be 100% sure to start taking action. It's not necessarily that you need to have a fixed diagnosis before you start taking therapy. Meet the neurodevelopmental pediatrician, get the developmental screening done. At the same time, also meet a speech language therapist so that they can also evaluate the child from the speech point of view and also start guiding you about what necessary changes you can bring about in your daily routines, in your play behavior, in your interactions with your child. You will never regret acting early. Remember that there is hope, there is support, there is a path forward. This is Meera Shah thanking you for being here. Please make sure to share this video with many parents, especially the ones who you feel are silently being worried about their child. Let's make sure that no one walks this journey alone in silence. Stay tuned and let's be in tune.